Hello, everyone. Welcome to another episode with Dr. Y. We're still talking about diabetes. Last time we talked about what is diabetes, and this time I want to answer a very important question a lot of people ask, which is I feel good, so why should I care that my number is high or the doctor says my A1C is up or any of this? It is an important question, and I do want to address it well. It's going to take us probably a few episodes to answer that question well. And I want you to please follow up with me. Now, some of the things I'm going to say are going to be hard to hear, but they are the truth. And I'm also very aware and very mindful that there are things outside of your control that can affect how things go with your diabetes care. But still, there's a lot of things that you can do about it, and I'll show you exactly how. So let's start. And before I get started, I want to remind you to please press that like, subscribe, and share button because it takes a lot of time to make those videos, and we'd like to get them to as many people as possible. So let's begin. This podcast is for educational purposes only. Please talk to your doctor before changing any of your medications or starting a diet program. There are 5 answers to this question. I feel good, so why should I care? Answer number 1, because feeling good doesn't mean you're healthy. Answer number 2, because trouble happens suddenly. Answer number 3, are you actually feeling good? Answer number 4, because it's not either carrots or cake. And answer number 5, because it isn't either your mortgage or your medicine. And I'm going to expand on each one of those answers and explain exactly what it means. So stay tuned. So let's talk about the first point, because feeling good doesn't mean you're healthy. Now, before we get into it and what that exactly means, I want to explain a very important point, which is that diabetes is not a death sentence. People who have bad stuff happen as a result of diabetes don't have it just because of having diabetes, meaning that diabetes as a label by itself doesn't make you less healthy, cause the problem in and of itself, mean that you're going to have complications or problems or trouble any more than having hypertension or having any of the chronic medical conditions indicates that you're going to have a bad outcome necessarily. It all depends on how you manage it, on how you address it. There are a ton of people who have diabetes, but they got it under very good control. They live completely healthy lives. They feel good, and they are doing well on the inside as well. And that's what I want for you. I want you to get to that point. So don't believe that just because you have the label of diabetes, you just have to have problems, or because one of your family members had diabetes and they had bad complications happen to them, that means that necessarily you're going to have bad complications happen to you. The idea is what makes diabetes cause the problems, cause the trouble, is the fact of having high blood sugar, having diabetes run out of control. It's not the label of diabetes. It all depends on how you manage it, and there is plenty of hope. Now that I've cleared that out, I hope I want to get into the answer itself, which is because feeling good doesn't mean you're healthy. And that makes sense if you think of it from a standpoint of other things that we go through in life. For example, an exam. How many times did you get a test and you thought that you did really, really well? You felt good about the test, you had no problem writing the answers, only to find that your grade was much less than you expected because you made mistakes and you didn't realize that you were making mistakes. The opposite is also true, that a lot of times maybe you had a test where you thought you studied very hard, you poured your heart and soul into the topic, and then you said, oh, I missed this, I missed that, I wish that I had answered this correctly, and you feel very bad about it, only to find out when the results come that you've done so much better than everyone else. So how we feel about something doesn't necessarily mean that this is what's happening on the inside or what's happening in the reality. There can be this bridge between what we feel about stuff and the actual state of that stuff. As a matter of fact, that exact example that I just cited to you is something that in psychology they call the Dunning-Kruger effect. Look it up if you'd like to know more about it. But it's very interesting, where it's actually the opposite. People who tend to think they know a whole lot, that they did great on tests, tend to not do as well as people who blame themselves or think that they did horrible on tests. And it comes out that the second group of people actually does so much better than the first group of people. So it's not just that feeling well or feeling good can be kind of neutral or not relevant. It can sometimes be the opposite. Like you see people that are very, very careful about their health, and they are very well tuned to things that happen in their health that might not be exactly what they want. Well, sometimes they are much more healthy than a person who just dismisses any warning sign in their health. So we need to think of it with a set of fresh eyes, and it's not simply that feeling good always translates to being healthy. Sometimes it is. Sometimes you're feeling good and you're healthy and you're doing great, but the point is sometimes with diabetes that might not be the case. And I'll tell you why precisely. It's because that the way that diabetes causes its damage and its trouble happens on the inside of the body and happens in a gradual and slow way. So you don't get to feel what diabetes is doing to you on the inside. So how does diabetes affect you negatively anyway? What does it do to cause a problem? As I told you before, that doesn't necessarily go with the just label of having diabetes. It is very much related to how the diabetes is controlled. So when the blood sugar is high, what that does is that it clogs up the pipes that lead the blood and the nutrients from your heart to all over the body. You can think of it this way, is that all the organs of the body, of course, need nutrition, need oxygen, and how do they get it? Well, they get it from the heart. The heart pumps it, and the heart in essence is a big pump. So it pumps the blood with all the good stuff that's in it, all the nutrients, all the glucose, all the oxygen, and it pushes it to all the organs of the body because all of them need it. So how does it do that? What does it utilize for the blood to get from the heart to your leg, for example? Well, there is a pipe or a series of pipes that we call in medicine the blood vessels, right? And the blood vessels that bring the blood from the heart to your organs are called arteries. The ones that bring the blood back after it's kind of done its job, and now it has all the trash that it collected from your organs, and it needs to bring it back to your heart. That those blood vessels, we call them the veins. All right. So as you will notice, a lot of times with doctors, they like to use big words. I don't know what's wrong with us, but it tends to happen that we always use big words to kind of describe simple stuff. So you can think of vascular complications, for example, such a big word as the trouble that happens on account of diabetes, right? So the diabetic vascular complications just means the problems, the trouble that can happen on the inside of those pipes as a result of diabetes. What is that trouble? Is that when the sugar goes up, those pipes, they get clogged up. And it depends on what pipe exactly gets clogged up, what problem tends to happen. For example, If the blood pipe that is bringing the blood to the kidneys, they get clogged up, that will cause kidney trouble. And with time, the kidneys can go bad in their function and start to fail on you, which can end up in dialysis or somebody needing a kidney transplant. Now, those things don't happen overnight. And again, I keep repeating this point because it's extremely important. They don't happen just because you have the label of diabetes. They happen when the blood sugar is up out of control for years, that it starts to cause this kind of problem. And the point is that you might not feel any different as this kind of problem is happening. Another example is the heart itself. So I said the heart is a pump, but like all organs, it also needs oxygen and needs nutrients. So some of the arteries, some of the pipes that go out from the heart, they actually go and circle back to the heart itself to give it the oxygen and nutrients that the heart needs. Now, because these arteries tend to kind of roll around the heart in the shape of a crown, they call them the coronary arteries. You know, from the crown, corona in actually Latin means the crown, from which we get the virus, name of the virus that's been plaguing us for such a long time now, since 2020. I don't want to mention it because I don't want this video to be banned on YouTube or whatnot. But anyway, you know what I'm talking about. So the coronary arteries can also get clogged up by this high sugar. So the high sugar kind of builds those plaques, those kind of junk on the inside of the pipes, and that can cause heart attacks, heart disease, heart failure, and so on. Now, take that with any organ. The nerves in your feet and in your hands, they are nourished also by small blood vessels or small pipes. When those blood vessels get clogged up by diabetes, you will tend to have, or people who have that will tend to have trouble. They can have pain, tingling, numbness, burning sensation, and then they lose sensation in those extremities like the feet, which makes it more possible to develop ulcers or, God forbid, amputations of the limbs. All of that can happen, again, as a result of high sugar, uncontrolled diabetes for a long period of time. Now, somebody may ask, why does that happen in the feet, though? Why, you said that, the nerves are nourished by the small blood vessels, whether they are in the feet or in the hands or anywhere in the body. So why does it happen in the feet? And that's a good question. And the answer is because it happens in the place that is farthest from the heart. I mean, if you think of your body when you're, standing up, what point in your entire body is the longest distance from your heart? It's the feet. It's the tip of the toes. It's your feet. That's why when that's the farthest point away from the heart, that's the point that gets affected the most by the nerve damage that happens on account of uncontrolled diabetes, to the point that if somebody is having a problem, the same kind of problem in both hands and both feet, I try to think of issues that might be happening other than diabetes, because with diabetes typically, and obviously there are different cases, but typically we would expect the feet to suffer more, the feet and legs to suffer more than the hands, and also we'd expect both sides to be affected. And that's again why if I see somebody who's just complaining from pain and numbness just on one side, on one leg, but the other leg is fine, I wonder whether that could really be diabetes or perhaps there is something else. Because diabetes, I mean, the blood vessels are the same that go to both places, and the nerves are the same, requiring the same kind of oxygen, same kind of nutrients. So if you just get one side really badly affected out of proportion to the other side in the legs, I would try to think of other reasons, perhaps in addition to diabetes, that may be causing the problem. But that is beside the point. I want to go back to the trouble that can happen from uncontrolled diabetes, or what we call the complications. So we talked about the kidneys, we talked about the nerves, we talked about the heart, and we also need to talk about the eyes, because the blood vessels that nourish the eyes also get affected by high blood sugar, and as a result of that, they can cause blindness. And one of the most common blindness in the world, and especially in the United States, is from diabetes. And all the developed countries, the main #1 reason for blindness, or one of the top 2 or 3 reasons, would be, depending on the country, would be from uncontrolled diabetes. So another thing that can happen is the blood vessels, or the pipes that nourish your brain. Well, they can get affected by diabetes as well, and a stroke can happen, and the person can have a stroke that leaves them with a lot of trouble going forwards. So all of these things are preventable. None of this has to happen. And by getting the blood sugar under control, a person can protect themselves very much from these types of complications. But the key here is to understand these complications don't just happen as a result of having diabetes. You're not doomed. These are problems that can happen with high blood sugar, even if you are feeling well. You don't know what's going on the inside of your body until you start checking the blood sugar, getting your blood test done, knowing what your A1C is, which we will talk about more in future episodes. And until next time, you have a wonderful day.